Hello, today we are going to discuss second-degree heart blocks. There are two types of second-degree heart block, the first being Mobitz 1, also known as second-degree heart block type 1 or Wenckebach. With this type of heart block, impulses are generated from the SA node, and each one is delayed a little bit longer at the level of the AV node until one is eventually blocked and not allowed to get down to the ventricles. Those that are conducted to the ventricles go normally through the conduction system. When looking at the rhythm, it is generally irregular. However, it is often in a pattern of grouped beats, kind of a footprint that repeats itself. When looking at rates, your atrial rate will be greater than your ventricular rate, since there are some atrial beats that do not have a QRS complex following it. P waves are going to appear uniform, and there is one P wave for every QRS complex. When looking at your PR interval, it is going to progressively lengthen. The phrase goes longer, longer, longer drop. Now I have a Wenckebach. Your QRS complex will be narrow, measuring less than 0.12 seconds. Here's our first example of a Mobitz 1, also known as a Wenckebach or second degree type 1. You can see my P waves here and our PR intervals lengthening until we have our P wave with no QRS complex, and it repeats itself here. You can look at your R to R interval, and it is slightly different, although not grossly irregular. Your atrial rate is 90 with a ventricular rate of 60 because, again, we have those dropped QRS complexes with these atrial beats. Here's another example of a Mobitz 1. These P waves, while they're uniform, they do look different than the preceding slide, the preceding strip. Our R to R interval is also slightly irregular, and then here we have our PR intervals circled, and you can see it is progressively lengthening until we have this dropped beat and repeating the cycle here. This strip also has an atrial rate of 90 and a ventricular rate of 60. Second degree heart block type 2, also known as Mobitz 2, is the next rhythm we're going to discuss today. With this one, impulses are generated from the level of the SA node. However, the AV node allows some beats to get through and also doesn't allow others to go through. So it conducts some beats and blocks others. Any beats that are allowed to get to the ventricles are conducted normally. With Mobitz 2, your rhythm might be regular or irregular. It will depend on the conduction ratio, and we'll discuss that a little bit more in our examples. As with Mobitz 1, your atrial rate will be greater than your ventricular rate. Your P waves are uniform, and there is one P wave for every QRS complex. One key difference between type 1 and type 2 of the second degree blocks is your PR interval. With Mobitz 2, your PR interval will be constant when it is measurable. Your QRS complex will also be narrow and less than 0.12 seconds. Here are a couple of examples. Well, our first example, we have our PR interval, and here's a dropped beat. Here is a P wave with a conducted QRS, P wave with a conducted QRS, and then here's a P wave with no QRS complex as it was dropped at the level of the AV node. You can see our atrial beats are circled here. When measuring the PR interval, it is constant across the strip. This particular example, your R to R interval is irregular, as the conduction ratio is 3 atrial beats to 2 ventricular beats. So we have a conduction, or three atrial beats and then one dropped beat. So we conduct 2 and then we drop a beat, and that's why we have our conduction ratio showing an irregular pattern. Our atrial rate is 100 beats per minute, as well as our ventricular rate of being 70. Here is another example. This particular example appears to be regular when looking at your R to R, as it's every other beat that is allowed to the ventricles, and then every other beat that we have a dropped QRS, as you can see here. Our atrial rate is 90, and our ventricular rate is 40. Our PR intervals remain constant with this. Here's a side-by-side comparison of the second-degree heart blocks. Your PR interval is going to be key with all of the blocks. With Mobitz 1, your PR interval is going to lengthen until you have a dropped QRS complex. And then with second-degree type 2, you have a constant PR interval. However, you do still have those dropped QRS complexes. Always remember when caring for your patients that you want to treat your patient. Blocks may come in succession, so keep that in mind. Your second-degree blocks might lead to a third-degree heart block, but always treat your patient, and remember the slower your ventricular rate, the lower the cardiac output of your patient will be, because that is where they're going to get their blood pressure, and that cardiac output is from their ventricular rate. Thanks for joining me.